Shaun, the kids aren't all right.
No, they're not, unfortunately, Andrew. No, the mental health of children and young people in New Zealand has been getting worse and worse for over a decade. And yeah, it's now reached levels where we're really calling on the government for some urgent action. And the reason we've launched a petition is because these numbers, which are now at the point where nearly 1 in 4 young people are experiencing significant mental distress, and nearly 30% experience depression and anxiety at some time in the last year. You know, it demands some urgent attention.
Absolutely.
We have been going to government agencies, to different politicians for years saying, look at these numbers, look how bad they are. What are you doing about it? And essentially we've really been getting the fob off. And as
Really?
recently as about 2 months ago, I had a meeting following the release of some new figures that showed not only are young people having the greatest need, but they also have the worst access to services of any group in New Zealand. And I asked health officials, what's the plan of action? And they basically said, well, we're doing a bunch of things, but there is no concerted plan. There is
Wow.
no kind of coherent approach to what we're doing about young people, which just absolutely staggered me. I just cannot believe that we have this trend of worsening mental health for our children and our young people, and essentially it's being ignored. It's not being given priority. There is no coordinated approach to how we're going to deal with it. So enough's enough. We are now kind of demanding that there's urgent action on this, and we're really trying to get the many, many thousands of parents, of young people themselves, of people who care about young people in their lives, who we know are also, many are desperate because they cannot get the support that they need for their children and for the young people in their lives. We want you all to come behind us in a petition to really hammer it home to the politicians and to the officials that urgent action is required on this.
Shaun, I can imagine, like, for young people, it's hard enough to even articulate or describe what they're going through and even mention that they're struggling to an adult or someone near to them, a mentor or someone who's looking out for them. Yet accessing care is another thing, right? Because even as adults, it's hard to figure out how you go and get help when you need to go to the doctor or whatever. But these are young people. So what do you think is needed? What kind of change is needed to help these young people? And also, how young are we talking? Like, to help these youth reach the care and access the care that they need?
Yeah, well, what is happening is that we actually have 4,000 less young people accessing specialist mental health services today than we did 18 months ago, because those pathways are so convoluted, and also because the threshold for being for getting access has been going up and up. So people are just giving up. Yeah, I agree. So what needs to happen? Well, look, if I was the Minister of Mental Health, Matt Ducey, I would be, and I would have done this a few years ago if I was the responsible minister. I would be calling the officials into my office and saying, okay, this is really bad. What are we doing now? What can we improve quickly? What can we do in the medium term? What can we put in as bids for the budget for 2026 to get some resourcing into this? And then give me a 3 to 5 year plan of how we're going to turn this situation around.
Shaun, do you think we've conflated spending with action in the past? Because I fear we've seen headlines about funding allocated but it seems like what you've identified is that spending hasn't turned into anything tangible.
Yeah, look, well, what it hasn't turned into is something that's actually turning the situation for young people around. Yeah, I mean, you can throw money at things and not have a clear idea of what you're doing and do it badly and it have very little impact. I mean, what we need is not just more services. We actually, we absolutely do need that. And I think, that's very urgent for young people. I mean, we have less than half the number of specialist child and adolescent psychiatrists in New Zealand than we need per head of population. But, we also need to address what's going on in schools. We need to address employment. We need to address housing. We need to address bullying. We need to address young people's skills to be able to deal with the pressures of a pretty turbulent world. I mean, climate change anxiety is a very real thing amongst young people. I mean, we've got technology like AI changing the face of employment and the world very, very rapidly. A young person today is growing up in a digital world that their parents did not experience.
Yeah.
So there are so many things that need to be addressed. Like, we need to actually be putting some pressure on the social media platforms in terms of regulating what they do. We need to, young people are saying through the research they want guidance and support and how to navigate something like social media. So we need to really address properly supporting our young people to be in the world that they find themselves in, and yes, providing those supports when they're struggling. So there are things we can do in schools. There are programs that already exist on a small scale which are proven to be boosting young people's resilience, young people's mental and emotional regulation skills, and have really positive flow-on effects to education and behaviour and relationships. We could be pumping those up. So, it is about using resources for the right things. But if we don't have a plan and if we haven't actually said, young person are the main issue within the bigger issue of mental health, and we haven't actually started to think, what can we do to address this, then, no spending is going to achieve much.
Yeah, Shaun, I couldn't agree more with you. So let's talk about the petition and how people can sign this to show their support and hopefully see change in this area.
Yeah, well, look, the simplest way is go to the Mental Health Foundation website and you'll see a link. Scroll across there to sign the petition. I haven't checked this morning how many we have, but it only opened on Tuesday, and at the end of yesterday we were close to 1,000 signatures. So it's starting to mount. I fully expect that we're going to get a lot of people participating in this because there are so many parents out there who have run into the brick wall when they've been trying to get support for their children and young people.
Hey, thank you so much for joining us as part of the Rhema whānau. We really appreciate your company. And if you'd like to check out more stories like that one, just click here.
In fact, our channel has a whole bunch just like this, stories that can encourage you and inspire you and make you more aware of what other people's lives are like in Aotearoa and around the world. So maybe you could subscribe right here.